Patients have to be qualified based on their past medical history, a physician's certification, and approval by the Department of Health. So not just anybody can come to a dispensary. There's a lot of prerequisites that have to fall into place. And there are right now 17 conditions. They're talking about approving some additional ones. Some of the commonalities are they're autoimmune in nature, they're inflammatory diseases. If you look at the components in the marijuana plant, the CBD and the THC are the two most commonly known components. They work very well synergistically to relieve pain and inflammation. Patient registration, it's really a four-step process. You would go to the Department of Health website, you would create an account and register yourself. From there, you would make an appointment with one of the certified physicians. Then from there, once you see your physician, you would go back on to the Department of Health website into that account you created, and you would pay a $50 fee, and then they would issue you your medical marijuana card. And then the last step would be coming to a dispensary like ours to actually get your product and be able to start your treatment. It's not like traditional pharmacy where you get a prescription, you go to the pharmacy and get it filled. We sit down with every patient. We spend at least a half hour, sometimes longer, with every patient, talking about their past medical history, their current meds, and how they would like to use the medical marijuana. There's a caregiver side of it as well. So if your patient is maybe not very mobile or really doesn't leave the house, or maybe is too sick to leave the house, there's an option for a significant other or a family member or really anybody to be that patient's caregiver. And there's a process to register for that as well. And caregivers can provide care for up to 5 patients. And a patient may have up to 2 caregivers. So those are other options. I'll tell you, that process is a little lengthy because they do a federal background check, fingerprints and all, on the caregivers because they want to make sure that the caregivers are upstanding citizens and, going to do what's requested with that marijuana.